The goals of progress reviews. Let's take a few minutes to discuss the periodic progress reviews and the educational benefits that come from doing them. What is a progress review? A progress review is defined as a time, usually every 4 months, when a resident prepares to discuss with his or her advisor examples of clinical experiences demonstrating effective learning. The preparation and reporting is done electronically, and the discussion is done face-to-face. Regular progress reviews are an essential component of all good competency assessment systems. In a true competency system, effective learning means that the learner is developing and practicing new skills that are important to solving real problems encountered in the clinical workplace. The 10 Sentinel Habits identify and clarify the skills necessary in the discipline of family medicine. Typically, several of these skills are used with each clinical encounter. Progress review discussions should demonstrate a resident who has been actively engaged with his or her patients and team members and uses the workplace to stimulate learning. A resident's learning is considered comprehensive by showing attention to the Sentinel Habits, clinical domains, and the 99 priority topics. Satisfactory progress of learning implies that by continuing his or her level of learning activity, the resident will successfully attain the upcoming milestones of the program. There is a second and related goal for doing progress reviews. The goal is to recognize specific learning needs or challenges that have become clear over the past 4-month period. The resident uses the progress review to identify events or feedback that have clarified knowledge or skill gaps. The advisor's role is to assist the resident's insight towards identifying areas requiring special attention. The advisor prepares before the meeting by reviewing field notes and comments from rotation assessments of the resident. The resident and advisor can then discuss a learning plan to address specific learning needs. The final purpose of the progress review is to provide a clear report to the residency program indicating each resident's level of progress. It is for this reason that each progress report is forwarded to both the residency program director and the postgraduate dean. Effective residents seek and use prompts and feedback from their work to stimulate deliberate learning. Overall, by demonstrating accurate interpretation of events and feedback, residents can use progress reviews to show competence as practitioners of guided, informed self-assessment, the important professional skill that ensures lifelong competence development and maintenance.